All right. Good afternoon, folks, and thank you for coming out today to the Illinois Higher Education Center's first webinar of the year, which is going to be Project Access, mitigating minoritized students' substance use and HIV risk using embedded prevention navigation. So today with us, we've got Dr. Dolores Cimini, Jessica Martin, and then a few of the prevention navigators with her as well. We've got Evan Osmat, Kara Fresquez, and Corey Monley today. So over, the conversations that we're having today, there will be a space to have, discussions at the end. We do ask that you can put them in the chat, and then I will moderate those for the end of the discussion. For anything related to IHEC questions or CEU questions, feel free to message me or send me an email after the presentation. For those of you that are interested, there is the opportunity to receive a copy of slideshows or the link for the video for later viewing. So without further ado, I'm going to introduce Dr. Dolores for today.
Great. Thank you so much, Annabelle, for hosting us today. I'm very pleased today to talk about Project Access, which stands for Achieving College Completion Through Engaged Support Services. So we also have the pleasure today of having two of our prevention navigators, Evan and Corey, who will be introducing themselves shortly. Evan, if you could move to the next slide. So we always have some learning objectives for you when we present. Actually, there we go. We have some learning objectives. So we're going to be talking about potential campus and community partners in implementing a program such as this. Also, we're going to be talking about how prevention navigators can be integrated into campus and engage in prevention and intervention work in places where students naturally congregate. And we're going to talk about some strategies that that you all can use that are associated with prevention navigation work. All right, so let's actually start by talking about exactly what Project Access is. So as we know, college students are coming to campuses with increasingly complex substance use, HIV, mental health, and other risk behaviors. What Project Access does is it trains students with lived experience with substance use, mental health concerns, and representations of various aspects of marginalization, diversity on our college campuses, and train them in strategies such as motivational interviewing, screening, brief intervention, and referral to treatment, and other prevention and intervention strategies. And what we do with Project Access is place these trained prevention navigators who are peers of our students in places where students naturally congregate. You probably know that most prevention and health promotion is done out of health promotion offices, health services, counseling services, and student affairs divisions. What we do with Project Access is we place students in settings that are a little different, in advising settings, in places on campus like our intercultural center and other settings where students naturally congregate. And so we're able to reach more students universally with the work that we do. Next slide, please, Evan. So this is myself and our co-project director, Dr. Jessica Martin. And next, we have a slide with our prevention navigator photos on it. And I'm going to invite Evan and Corey to introduce themselves.
Yeah, so my name is Evan Osmat. I am the lead navigator with Project Access. I'm a third year in the counseling psychology doctoral program. A student who is also in long-term recovery from opioids. And so this work is really special to me. I think it's the type of support that I really could have used in my undergraduate institution, and there was no such type of program available to me. And so, yeah, it's a really, really wonderful thing to be part of.
My name is Corey Monley. I'm also a third year in the counseling psychology doctoral program at the University at Albany. And like Evan, I'm someone who developed an interest in this kind of work through my own experiences in recovery. So I've been in recovery now, just over a decade from substance use. And yeah, my addiction issues really peaked and when I started undergrad, and there was nothing like this at the university I was going to. And it could have really helped me maybe prevent some pretty significant consequences. So yeah, like Evan, I am really glad to be a part of this program, really glad to have had the opportunity to help students and engage in prevention navigation, because it's just so rewarding personally to be part of this.
Right. Thanks to both of you. Next slide, please. So as we develop Project Access, we've worked with the Strategic Prevention Framework, which I'm sure that all of you are familiar with. It's a 5-step process, and we'll go through each of these steps: needs assessment, capacity building, planning, implementation, and evaluation through the rest of this program. Next slide, please. Okay, so in terms of needs assessment, what we have done is looked at the literature and looked at our own campus data. And surprising to me, college settings are really a place where the HIV epidemic is very, very prominent. They're really called an epicenter in some of the research. And the data that we have in our state actually is consistent with that. The zip code that has the highest prevalence of HIV infection in our state is the zip code for our college campus. And now we have many students coming from New York City area and Southern New York, you know, where HIV is also very prominent. And so as a result, you know, we have to be ready to deal with those issues. And then with regard to substance abuse, we all know what the literature says on that. And, you know, we also have our share at our university of substance use issues to address. And we also are very active in Project Access in addressing issues of opioid misuse. Next slide, please. All right, and so how Project Access works in terms of capacity building is it has 3 parts. We engage in individual prevention navigation. Our navigators meet individually with students in settings where they naturally congregate, and they have conversations with them using motivational interviewing. Secondly, we educate our students. So in addition to the individual navigator meetings, we are very active in delivering educational programs on our college campus, in our student union, online, and also through curriculum infusion, going into classes and talking with students about these very important topics. And then thirdly, we have engagement, we have follow-up, and that is not only are we contacting students in one interaction in Project Access, we are following up with them. We are collecting data, and we are monitoring how over time the work that we're doing in Project Access is affecting our students. And Evan will show you some of that data shortly. Next slide, please. All right, and so capacity building is very, very critical in terms of the importance of building partnerships. And if we go to the next slide, you can see some of the partnerships that we have built at Project Access. So we are at the center in terms of the program that we operate. And we have had 2 primary partners that we've built relationships with: our Educational Opportunity Program, where our students who are economically and academically disadvantaged as defined by our state have, you know, learn and engage in receiving services. And also our C-STEP program is very important. And that's our science and technology program for our students from marginalized backgrounds. So we started working with them, and now we've expanded to other types of advising settings. So on the left, you see some of our campus partners. So these are no-brainers in terms of partners that we want to establish relationships with: our health center, our counseling center, other departments on our campus that work with students, so then we can help to provide timely and culturally responsive referrals to these agencies as a result of our navigation efforts. And then we also have community partners, so agencies that work with HIV/AIDS and substance use. They are very, very active partners and collaborate with us in doing our educational programs. We bring HIV testing on campus, as well as opioid reversal training. Next slide. So we operate Project Access in terms of looking at how we're doing and looking at the impact we have in using an iterative process. That is, we collect data, we evaluate it, and then we plan accordingly based on the data that we have. We engage in a number of plan, do, study, act cycles. And then what we do is we engage in updating our work, always with a focus on promoting equity for all of our students, because our campus is indeed very, very diverse. And then, you know, we make changes to our project accordingly. And if we go to the next slide, you'll see specifically how we have implemented the various phases of Project Access, and you'll hear also about our plans for the future. And at this point, I'm going to pass it, I believe, to Evan, who's going to take the next piece.
Yeah, absolutely. So as someone who's jumped on to Project Access right at the start, I've had the opportunity to see the project grow through all of these phases. And so I want to give you a quick summary of what that looked like. So we started out with a 40-day pilot program in the spring, gosh, now 3 years ago. Yeah, 3 years ago.
Yes.
And during that time, you know, we started it right after midterms. So not a wonderful time to start, you know, a pilot program in terms of getting students engaged, but we were really surprised with how well students responded, and the counselors in the Educational Opportunity Program responded to what we were doing. And so we had the opportunity to engage with 44 students, and they completed 30 to 60-minute check-in appointments and surveys, and we were able to track some of their engagement, indirect engagement with our project through some QR code scans. So we get to account of how many students scanned our well-being check-in pamphlet. So like I said, about 2 weeks, actually it was 2 weeks before midterms that we started, generating a lot of interest for that busy time in the semester. And of course, we knew that we had to initiate conversations based off of decades of work done by Dr. Cimini and Dr. Martin at the Center for Behavioral Health Promotion and Applied Research. So that's really what the focus of this pilot program was, a lot of educating students about what the project is, and then going through you know, all of the key focal areas of the grant, providing education on HIV, viral hepatitis, risky substance use, and really meeting them where they were at in terms of offering referrals that maybe weren't part of our immediate focal areas. So I'll give you a quick tour of what our pamphlet looked like. So the QR code here would bring a student to an interactive survey screener. It quizzed their knowledge about our focal areas, HIV, viral hep, risky substance use, and would give them some feedback depending on how they answered, and they would set up an appointment with us. So during that 44 days, here's just a look at some of the interventions that I was conducting with these students. You can see risk education, alcohol or other drug education, STD, viral hepatitis, HIV. Of course, those were standard parts of the semi-structured interview that we put together that was based in motivational interviewing and ESPER. But you'll notice that there were some other interventions that showed up as well. And this is sort of represents the flexibility with which we discovered we need to be really responsive to students' needs. We couldn't just stick to our immediate focal areas, because sometimes students had really pressing concerns that were outside of our scope, and there was a strong responsibility to make those connections, which was very much in line with how the project would continue to grow. And of course, we made lots of referrals and warm handoffs. 17 students, many received more than one warm handoff to a variety of services offered by different community providers. Those who weren't interested in getting a warm handoff during the appointment or at the end of the appointment had the option to request referral information. So we would send them an email after the appointment, say, well, let me send you all this, the address, telephone number, hours of operation, even bus lines for how to get there. Our goal was to try to remove any and all barriers that we could to help the student access the services. And of course, we would follow up with the students afterwards to make sure that the referral that we offered was one that fit their needs, and if not, we encourage them to set up another appointment to find one that was maybe a better fit. As part of this pilot program, we included some measures in the survey that were included at the request of the EOP director. This was really great for buy-in and for just making sure that the office that we were partnering with really felt like we were working with them, and sort of having some shared goals. And so we asked how academically inspired. This is something that the EOP director was very interested in, collecting data on about her students. And of course, we collected some qualitative data as well. And so we were able to ask, what they could do to help their students feel more academically inspired. Of course, we got a lot of great feedback. That's always nice to share with partners, that they're already doing a really great job. And then in terms of ways that we could help increase how inspired academically the students felt, a lot of the students, in line with our sort of needs assessment and just taking a pulse on the students on campus, is they were asking for more programs like the ones that we were offering, the education programs and appointments. So the expression "building the plane as you fly" has become increasingly familiar across education. It definitely captures feelings of risk and uncertainty that accompany designing innovations and testing them in real time with real students, all while being responsible for keeping existing things running. So reflects this idea that you know that you need to try to build something different even as you're still having students on board. Who are entering your doors every day in need of a range of services. So building capacity, training, implementation, and evaluation are sort of all happening at the same time. And so the end of the spring semester of this pilot program lent itself to training and preparations for a summer orientation program. So with that, I'm gonna actually do one more slide to talk a bit about the SBIRT approach. So we train students in motivational interviewing principles and skills, and these are foundational to SBIRT, which is screening, brief intervention, referral to treatment. It's an evidence-based public health approach to identifying students who are at greatest risk for risky substance use disorders, and taking steps to help prevent the development of serious substance use problems, or referring those who need it to treatments. So we've tailored this SBIRT approach to incorporate education on HIV, viral hepatitis, risky sexual behaviors, and we've trained navigators to know when to refer students for services, which resources might be most helpful. And of course, the students we see also let us know what they need. And so we sort of use that as a way to collect information about what types of services and partners we should be exploring as we grow. So a major part has been meeting students where they're at in terms of their readiness to change, their interests in resources and referrals, and just really listening to each individual student's needs. So of course, as I mentioned before, we did branch off from our focal areas of the grant, and often addressing academic concerns, giving referrals to tutoring, really whatever was preventing that student from feeling successful in their academics were things that we were interested in providing referrals for. We also ask about mental health. Students, or navigators rather, are trained in a suicide protocol. And so, we do have, our directors, Drs. Cimini and Martin, on call during these times. So put a lot of forethought into how we could do this responsibly, and make sure that we are able to catch any serious mental health concerns and get appropriate referrals to crisis or to our counseling center, whatever was most appropriate, and making sure the navigators feel supported as they're broaching these difficult topics. So with that, I'm going to hand it over to Corey to talk a bit about our summer program after the pilot program.
Thanks, Evan. Yeah, I'll share today just about the experience of providing prevention navigation, my side as a prevention navigator, but also student side, participating in these actual well-being check-in appointments. And then I'll go over some findings we found in this pilot program. So I think the really interesting and unique part of this program was the flexibility that that we were able to get through the peer navigation approach. Like our ultimate goal was really to get people connected, get students connected with these resources on campus. And I think the peer support prevention navigation aspect of this was a huge part in that, compared to these students perhaps meeting with a therapist or a counselor or a social worker, even if they happen to have been embedded where these students are congregating. So focusing on that sort of peer aspect of prevention navigation, I was also really interested in making my appointments with students feel more like a conversation, than a therapy session or an intake or something like that. And I recognized that students were coming from a place of experiencing a lot of health disparities, maybe growing up, in communities in New York City that weren't the friendliest in terms of health providers, and that some of these students might be really skeptical when engaging with health providers. So all of that being said, I really wanted to foster a sense of connection with them, because I knew that sense of connection would be the thing that would help them connect with the resources. And so there are sort of three ways I went about accomplishing this. And Evan and Doctors Cimini and Martin were a huge influence on the approach I took with students. So the first thing I would focus on is building rapport with students from the outset, like before the appointment even starts. And these are 30-minute, 20 to 30-minute brief appointments. So there's not a lot of time to make that connection. So even just grabbing them from like the waiting area where they were sitting, being sure to make a comment on, a t-shirt that they were wearing, or their hair, or their, clothing, something, give them a compliment to foster that connection. With the actual sort of psychoeducation related to the substance use, to the HIV, viral hepatitis, and the other health risk behaviors, Evan suggested conducting it using a question and answer quiz approach, which is sort of a staple of motivational interviewing, figuring out what students know before you launch into teaching them things. And that kept the psychoeducation really light and engaging for the students, and I think helped them retain the information that they were getting. And then the last thing I try to do is obtain feedback on their experience throughout the appointment. So just regularly checking in and asking them, what they're learning from the conversation and how they can apply that to their health behaviors. And I think in general, just approaching appointments in that way kept students engaged with the material and thinking about ways they could really make some behavior changes as they're adjusting to college life. A few other points that I thought of while conducting prevention navigation is really balancing the psychoeducation and the peer support piece, and remembering that it's not psychotherapy. And also being in that peer role, I felt more comfortable being able to do some self-disclosure about, substance use and mental health challenges that I had overcome, and the role of different mental health, behavioral health, and other health services in aiding my recovery. So really trying to model successful engagement with these services. You can see here on the slide, a big aim of our program, the largest aim was to get them to access resources. And we devised this, what did we call it? This resource card that had a list of all their resources they could possibly access, or their appointments with us. It was also sort of integrated with the Educational Opportunities Program that we were piloting Project Access through. So I think it was a good attempt, right? This is like what Evan was talking about, building the plane as we fly. But I think this part of the plane had a lot of gizmos and gadgets and moving parts, and it was a little too complex, but it was a good start. And I'll get back to suggestions on this later as we're talking. So, all right, now I'm going to talk about sort of the structure of the summer orientation program. So the actual project access part was 15 days of the total EOP program. During that 15-day time frame, we saw 108 incoming first-year students across 13 evenings during July. And a majority of the students who were unable to complete appointments during the summer came back in the fall and completed virtual appointments. One of the really important aspects of this program from reducing risk was a 3-hour opioid overdose prevention training. And during that training, there were 118 students in attendance, and we were able to distribute over 200 naloxone kits that also included fentanyl test strips to really make sure that these students were staying safe and that their friends were staying safe and if they encountered someone with an overdose. All students received health education with at least one of our community partners. And we, of course, also collected pre and post evaluation data to help evaluate our program, which I'll go through here now. This slide just shows some more attendance details for health education and testing events. All the students that we met with attended the naloxone training, and Albany Medical Center and Alliance for Positive Health engaged with around 75 students between health education and testing and information events. So that was more on the sexual health side of things with the HIV and the viral hepatitis. The reproductive health education provided by Planned Parenthood was also attended by 65 students. So we're reaching students in multiple areas and a lot of students in these intersecting health areas. Going more into some pre and post participation data at the start of the summer program, roughly 70% of students did not know their HIV and almost 80% did not know their hepatitis C status. And in terms of their knowledge of services, just over half of students knew where to find professional help for alcohol or other drug problems and HIV or other STIs. So we're seeing a really big gap here in students' knowledge and access to resources. So it's clear that they need a program like this. So now moving on to the post-participation data. By the end of the program, we discovered that around 10% of students had learned their STI status and that many had engaged in conversation with their partners about their sexual health. So not only is this reaching students that are participating in our program, it's also sort of spreading out to their friends and their partners. We also saw a notable increase in the knowledge of where to go to receive alcohol and other drug and STI services. Something to note is that we only asked about services near our university at post-test, just because it didn't make much sense. These students were new to our university. So if we asked them, hey, do you know these resources on campus? Of course, they would have been like, no, I don't. So we just asked that at post-participation, but found that students really had a high level of resource knowledge. In terms of a quick summary, there was a 15% increase in knowing where to go at home for alcohol and other drug and HIV and STI services. And then at that post-participation on the university, 80% knew where to go for alcohol and other drug services and STI services near or on our campus. So that's like the broad picture in terms of the data. We also asked students about their experiences within prevention navigation appointments. And 80% of students reported learning quite a bit or a lot about lowering their risk for HIV and AIDS, lowering their risk for hepatitis C, and lowering their risk for alcohol and drug use. And so when I look at these graphs, I think they really demonstrate just how helpful that peer navigation approach is to helping students acquire this knowledge about their mental health and their sexual health and their substance use. And it's important knowledge because we know that risk factors for these problems are not independent. They sort of pool together, right? So if you're using substances in some risky ways, that's also increasing your risk for sexual health problems and mental health problems. And then those problems might increase your risk to using substances to cope and on, creating sort of a vicious cycle. So we also asked students for some open-ended feedback on their appointments with navigators, just in terms of the process of prevention navigation. And we found that they felt supported and safe. And again, they talked about how valuable this knowledge was that they were getting about sexual health and substance use and resources. We did receive some suggestions for improvement as well. So what we learned is that students wanted longer appointments or more appointments, and I think that just really goes to show how much they were engaging with Project Access. And then, like we had mentioned earlier, these appointments were actually delivered at night. So students were requesting daytime appointments. That's not just important for students' schedule, but it's also important as a way to be able to make warm handoffs to community agencies that probably aren't going to be open at 7 or 8 o'clock in the evening. So now looking at some more focused outcomes. We saw that over 80% of students said they would refer a friend to a prevention navigator for help. This is really great because these programs work by word of mouth, and it just goes to show that students are really engaging and finding services like Project Access to be valuable. So just sort of summarizing what we learned from this pilot phase of Project Access with the Educational Opportunities Program. The sort of big take-home message was that when integrating Project Access into university services, we really need to make sure that there's a streamlined and seamless integration. Another recommendation was focused on EOP student leaders. So we had students in the EOP program that were sort of helping us with the prevention navigation, reminding students of these appointments, getting them to appointments. But some of the student leaders really had a hard time understanding the point of Project Access and how it was meant to help students. And so what we learned from them is some ways that we can ensure that our partners and stakeholders really know what Project Access is when they're communicating about it. So in the future, when we are working with students that are helping us on our campus and training them, because we train partners, is to make the educational portions of that training more interactive instead of just a lecture format, including maybe some role playing and practice scenarios about how faculty, teachers, staff, other students can talk to students about Project Access and what it is and how it can help them. And then giving them a sort of a psychoeducational handout, like a one sheet or a pamphlet that really covers some key facts about alcohol and other drug use and risks and HIV risk and sexual health risk. So that is the summer pilot program. And now I believe I'm turning it back to Evan.
Yeah, thanks, Corey. Yeah, so that sort of wrapped up our first year of Project Access, and that was phase 1 and 2. So the pilot program, and then the summer orientation program. And so here we are in fall of 2022, and we're onboarding 5 new navigators. Again, building the plane as we fly. So we're doing lots of planning. We're trying to train these new navigators in the systems and in the actual appointments themselves, and provide role plays and provide information about different referral sources that we have in our Rolodex, and meanwhile evaluating how everything has been going in the pilot program and in the summer program in this time, and using that to sort of inform what we're doing. So we developed peer and community advisory boards during this phase of the project as well. We began scheduling campus-wide health education events, where we would invite Oasis in New York State to offer naloxone trainings. We invited the same community partners we worked with in the summer, Upper Hudson Planned Parenthood, Alliance for Positive Health, Whitney Young, to offer targeted education events, for instance, during Prep Aware Week. And Planned Parenthood had some really great programs that they've since expanded in other phases of the project. We also put together a health literacy mini course series, and we piloted this with the same EOP students that we'd worked with in the summer. And the first instance of this series is a health insurance 101, interactive and didactic health insurance 101, where we go over insurance terms. So I'll talk a little bit more about that, but really helping students understand confidentiality and what health insurance is and how to best make use of their health insurance coverage. We got some feedback during the summer about our testing events. They were somewhat public. We had them in a space where there was lots of free condoms and lube and community partners there, and we didn't get nearly as many tests completed as we had hoped. And we got some feedback from students in the program, and you know, not a huge surprise, but students want more confidential and maybe even anonymous testing opportunities on campus. So responding to those requests and that feedback, we put together an automated anonymous HIV STI testing appointment and reminder system where students could schedule, put in a fake name, fake email if they want, get a text reminder, and meet on campus with a community partner, for instance, Alliance for Positive Health, and receive testing services on campus. We also engaged in this fall in a lot of tabling and activity during the week leading up to and including World AIDS Day. Being a Minority AIDS Initiative grant through SAMHSA, this was an important week for us. We wanted to put out a lot of really showcase a lot of our community partners and offer testing services to students. So as I talked about, these are some of the events and the promotion that you can see. This is our Prep Aware Week. We had Upper Hudson Planned Parenthood offer an Anatomy 101 and a Consent 101 event, which was really well received. And for Albany Medical Center, we invited them to table with us and to offer rapid testing, prep intakes, linkage to treatment to students during this week. And as I mentioned, we had that Health Insurance 101 workshop, which we anticipated only doing once or twice. And it was so well received, and the students were so engaged. The counselors, professors that whose classes we visited found this to be such valuable information that we ended up delivering this workshop to every single counselor's class. I believe it was just over 100 students received it in our pilot. So not what we were anticipating, but really a very welcome surprise. And of course, we evaluated those pre and post and use that feedback to further tailor the approach. But really, it's an interactive workshop where we go over insurance terms for the first portion of it. And then we ask students to bring their insurance card, to bring their laptop or device, and we help them explore their insurance website, make an account, and we have a handout where students will complete it. And it's sort of like a quiz. You know, how much is your copay for an emergency room visit? You know, do you have inpatient alcohol or other inpatient addiction treatment services covered under your insurance? And so really giving them an opportunity with some guidance, because as I'm sure everyone knows, if you go onto your health insurance company's website, it's not intuitive. Sometimes it feels intentionally obtuse even to navigate through some of those websites and really get the information you're looking at. So this also served as a way to draw students into appointments. We didn't know every answer, but we do know how to find the answer. So that was something that came up over and over again during these workshops. So for phase 4, as Dr. Cimini had mentioned, we began embedding prevention navigators into more areas and expanded our community and campus partners. So we started working with the Gender and Sexuality Resource Center in our campus center and embedding a prevention navigator there to engage with students. And of course, we had our peer advisory board running, which was really valuable. They helped us really understand the needs of students and gave us a lot of insights into how to promote the work that we're doing, to get the word out about what Project Access is, what Project Access does, and what we need to be doing more or less of as well. Of course, we began developing and implementing a culturally responsive social norms campaigns with some of the data that we had been collecting. And at first, those began working with in students with during appointments where we might communicate some of those statistics, some of those norms that most students aren't using cannabis as frequently perhaps as they think everyone is, or vaping or what have you. We increased our testing opportunities, partnered with Alliance for Positive Health to offer more regular times with those automated system. And we really began building our social media presence as well. That's a place where, as I'm sure folks know, students are spending a lot of time on their devices. And so we want to make sure that we're in that space as well, promoting health and well-being. So this past summer, leading into this fall, we used this time to plan because we were doing planning this fall a big expansion, campus-wide launch. And so as Dr. Cimini had mentioned, we had planned for integrating with academic advising. So we offered students early registration opportunities in the Human Development Program if they completed a navigation appointment with one of our prevention navigators. And we saw, I believe, over 50 students in the start of the fall as a result of that planning. And of course, you know, unlike the summer previously, you know, we were really busy delivering the summer orientation program. This was something that was made possible through shifting gears to making sure that we had the infrastructure, the capacity, the plan in place to be able to do this and to increase our on-campus presence. We developed new workshops and improved our existing ones. So we developed a sleep, substance use, and positive psychology workshop, as well as a substance use and suicide workshop, which we have since delivered this fall to a number of students. And of course, we really honed in that Health Insurance 101 and delivered that a number of times this semester as well. Scaling up our outreach efforts has been a huge part of this this summer to fall, this planning and implementation phase. Most recently, we've really stepped up our tabling presence on campus and in the residential halls, which has been, as you'll see in a slide or two, a huge source of our engagement and getting the word out about what we're doing. We began offering mental health and substance use screenings as well, as part of those tabling events. So they have different themes. Some have our prize wheel where, students can spin a prize wheel and answer a health-related question. And if they get it right, they get a piece of candy. And if not, they get to spin again and try again. And that's been really, really great for drawing a lot of students to our table and increasing engagement. And others have these screening days attached to them. We've even brought therapy dogs, which I will say have been by far the most popular of all of our tabling events, when we have 10 or 12 therapy dogs just roaming around. No surprise there. We offered those peer-led navigator workshops, and of course we increased the number of community partner events that we were offering to the campus community and really advertising those. Like I mentioned, digital presence, social media, and the use of progressive web applications. By really honing in and planning out our posting schedule and making sure that we were hitting all the important points and using our stories and our posts really effectively, we've been able to increase our followers on Instagram from 86 in the summer to over 200. We've developed this resource Rolodex app, which I'll give you a little bit of a tour of towards the end of the presentation. Basically, it's a place where everything Project Access lives in a mobile-friendly space for students to engage with and to access resources outside of appointments and to schedule appointments. And we use the same type of technology to develop mental health screening apps and substance use screening apps, where a student will complete this on a tablet, hand the tablet back to the navigator, and they'll be getting, the navigator will then receive instructions based off of the screen for what to do. If they are required to call one of the supervisors, a licensed psychologist, because the student has endorsed suicidal thoughts and are at risk. So that's something that's really helped and will continue to help with the training and the onboarding. And so this is the types of innovations and pieces that we're trying to put in place so that we can make our building, we can build the plane a little bit better, a little bit faster each time we have to while we're flying. So I have some pictures here of our tabling. You'll see our lovely prize wheel there on the left and right. And so, like I said, this is an area where we're getting lots of engagement from students. This is a brief look at some of the posters and flyers that we're posting on Instagram around campus to promote these events, sending out on listserv emails. We had Whitney Young doing a viral hepatitis education, Prep Aware Week education. Really well received was the addition of Planned Parenthood's Birth Control 101. That was our most attended workshop this past fall. A lot of really valuable information that students were engaging with. And that came through the evaluation process. We asked students, you know, what they would like to see from our partners, and Birth Control 101 was one of those things. And of course, for Albany Med, you know, being involved this upcoming World AIDS Day and the week preceding that, we'll have them similarly on campus offering testing services. But we put in, included in that testing automation system, Prep Aware or prep intakes with Albany Med. So we're sort of expanding the types of services that our community partners are able to offer students on campus. So that's been quite successful as well during this fall. Our most successful, echoing the summer, has been our naloxone training. I think we've had over 150 students in attendance, people calling their friends and asking, you know, telling their friends to come, you know, 10 minutes in because they didn't know, they hadn't registered. So it's been a really popular, highly needed type of education training event. And then here's a picture of our of one of our workshops as well. So as I mentioned, those are the 3 workshops we've been offering. I'm not going to go through all of the numbers here, but to give you an idea of some of the data, you can look through the different categories. But tabling just for this fall, 531 students we engaged with for an average of 5.8 minutes. This is pretty long. We have the prize wheel to think, I think. It keeps students engaged, keeps them talking to us, and I think both Corey and Dr. Cimini can attest I might be pretty persuasive when I talk about project access and keep them focused on all the different things I can show them, resting on my own excitement about the work. But as you can see, we cover a lot of areas in terms of providing education, and those are all represented on the prize wheel, those different categories you see on the left. And we'll give referrals at the table. We'll show them the Rolodex and help them get access to referrals themselves. Overall, since the start of the project, our group events, you can see the different categories for interventions and referrals there, but we've had a total of 227 attendees and engaging with our programming for almost 90 minutes on average. We have the naloxone training. It's a 3-hour training. We have that to thank for our increased average for sure. It's a very popular one. And then since the start of the program, navigator appointments, interventions, and referrals. And this is not including the pilot over the summer. This is just the full launch, phase 3 and phase 4. We've had 156 appointments for an average of 31 minutes. So you know, this is our bread and butter. This is where we're really wanting to engage with students and get that one-on-one time where we can really meet their needs. And you'll see a number of different categories, things like mentoring come up when students are interested in grad school and stressed about what they're going to do afterwards, career services. We cover a lot of ground in some of these appointments, but you know, as the structure has really been honed in, we found a way to make sure that we're hitting all of the health education points that we need to in a really efficient way, in a way that students are absorbing and engaging with in the appointments, while also leaving enough room and space to address some of those concerns that are maybe outside of the immediate scope of our grants work. So I want to give you a quick tour of that resource Rolodex I talked about. So you could, on your phone, if you're here now or watching the recording, you could scan this QR code. And so what you'll see here is a little video that takes you through what a student might do. They might see our flyer around campus, scan that code, and open up to this website. They would, you know, get rid of that pop-up there, and then they you know, might look at some of the directions to add this to the device. So this is a progressive web app, which means a student could add it to their home screen. It lives there on their home screen the same way a bookmark would. And so a student, you know, I show them this, they say, you know, it's just a bookmark. It's, you don't have to go to the app store. You just, you can delete it if you'd like. But to give you sort of an example based off our engagement time, a student might, you know, open up the app, swipe up to, close that pop-up that gives them an idea of what those 4 icons on the bottom do. They can learn about our project, that we're an innovative translational research initiative at UAlbany, funded by a grant from the federal government. We have a video there. We also have videos about HIV, STI education. But when they hit that search icon, this is where they access the resources. So a student may be looking for sexual health resources. Maybe they found out that they had a sexual partner who tested positive for an STI. So they head over to the Whitney Young Health dropdown, and they might take a look at the website and say, oh, okay, that's good to know. Well, maybe I'll go to Planned Parenthood, or maybe Damien Center, or Alliance for Positive Health, maybe even Albany Med. But you know what? There's so many services. I don't know what I'm going to do. Maybe I'll just try to schedule one using the calendar icon on campus. But maybe that student really isn't sure if they even need to get an appointment for testing. So they're going to schedule a navigator appointment by clicking that drop down, and that'll take them to our scheduling portal here. So they're going to ask to see all the available appointment times. This is from back in October, so last month. They might pick the very first available time and give us a little bit of information. So they'll type their name, they'll type in their email. They can opt in to get text message alerts and reminders for their appointment. And we'd hope that they'd give us a little bit of information about what they're hoping to get out of the appointment. So this student is looking to learn a bit more about sexual health to make the decision. If they want to get testing services, or if they really need testing services. So they might be looking for that education. So they'll schedule that event, and they'll be notified that the navigator will send them an email with the room number where they can plan to go for their appointment. And we hope, fingers crossed, before they leave the app, that they'll head over to our Instagram tab and learn a bit about what we post, different tips and resources, tips for enhancing health and well-being, resources, and alerts from DEA and other agencies about fentanyl-laced substances being sold in the Albany area, because our goal is harm prevention. We want to keep students safe wherever they are in their journey in recovery, or in just to be in the harm reduction world. It's all fine for us. We just want to make sure that they're safe and alive, really. So since putting this progressive web app into action at this phase 4 this fall, we've had 273 total users, 259 are new users to the app. And what you see here on the right is the referrals. So we're able to track through this app when a student clicks a link to a resource, or they click the phone number to make a phone call. That gets tracked through this analytics software, and we find out how many students are actually using resources. So what we discovered is about 20% of the students who are using our resource Rolodex app are connecting with on or off-campus resources using the app. And in that subgroup of 20% of users, they're accessing more than 3 resources each on average. So the information is getting out there, they're watching our videos, they're learning about our project, and about 20% of them are not just using it for one resource one time, but they're returning, they're coming back, they're seeing it as a valuable tool to put all of what is available to them, the way we say it, what they're entitled to, what they've already paid to. These aren't free services, these are paid. You've paid taxes, you've paid your student fees, you're entitled to these services, use them or not. And so we do see a lot of engagement through this. And just before we wrap it up for questions, want to give you a little bit of a tour of our Instagram feed here. This has been a huge part of really growing the project in this phase as we've done our full launch. So as you sort of see the scroll going through all the posts, some of these are from the previous spring, last spring. But once you get up to our welcome back post, you'll see here we have some of our Anatomy 101. We're introducing navigators, we're introducing project directors, we're talking about gambling, we're talking about intersectionality, promoting our work. So here where it says welcome back Great Danes, this is this fall. And so you'll notice the volume of our posts has increased. And so this is a really important piece, I think, for any type of project looking to expand and really reach students, is to make sure the social media presence is really really robust, not just with the posts, but with the stories, and making sure someone who's looking over this account is responding to messages. Sometimes we'll get messages asking questions through our Instagram account. But I will say that this has been, you know, it's been one of the key factors in reaching students. The tabling, social media presence, that's what brings them to be able to access our Rolodex, be able to access Navigator appointments. And so with that, that brings us to the end of our Instagram feed and the end of our presentation. And I'll open it up for any questions that folks might have.
For any participants that have questions, you are welcome to unmute and ask them as well. All right, well, if we don't have any questions, we can wrap up, but thank you, Evan and Corey and Dr. Cimini, for all that wonderful information. I'm really glad that we were able to have this time today to learn from all of you. And, if I have any questions from any of the attendees, I will let you guys know. For those that have attended, I am going to put the survey link in the chat. If you could just save that for later. Let's see if I can get that. So this is the mock form that'll take you to the survey, and it'll also ask if you need any CEU credits. I will need you to fill that out if you do need those. But otherwise, thank you so much for your time today, and we will look forward to hearing from you guys in the spring.
Thank you.
Thank you so much. All right, well, I'm going to end the recording.